We know people with long-term conditions are more likely to experience depression. And when these problems exist together, they reduce the quality of life for the patient, and they can also be very costly for health and social care services. There is a call to identify treatments that promote prevention, enhance opportunities for patients to self-manage both their physical and emotional health care together. This is particularly important for people over 65, as they have more long-term health conditions, and they often find accessing health care services quite difficult. In the MODS programme, we're working with a range of academic and clinical partners alongside Age UK and people with lived experience. We aim to refine treatments that we've seen work for low mood in previous studies and explore how they can improve both physical and emotional functioning. We'll focus on older adults who have depression and 2 or more long-term health conditions, like diabetes, asthma, heart disease, and those such conditions. We want to look at whether a talking treatment called behavioural activation can help. Behavioural activation helps people look at the link between what they do and how they feel, and what changes they can make to improve their health and well-being. This will be provided within a care framework that supports a case manager, such as a nurse, to work with both the patient and other healthcare providers to enhance treatment delivery. This is called collaborative care. In the MODS programme, we'll use 4 interlinked work streams to refine and test the treatment and explore how best to help NHS services use them. We will first develop the new treatment by looking at those we've used in other research studies. We will then talk to older adults with experience of low mood symptoms and physical health problems and healthcare professionals to think about the changes we need to those treatments. From this, we'll develop a training and materials for patients to use and deliver the treatment to a small group of people in succession. Based upon what we see and talking to those people, we'll further refine the treatment and then take it to another small group of people to test how it's going. Finally, we'll then talk to a consensus group made up of a range of healthcare professionals and people with lived experience to come up with a final version that we will take forward in the programme. We will then conduct a small trial of the intervention to check that we can recruit to the study, deliver the treatment to the people in the study, and then follow people up. This is called a pilot study. And as well as looking at our research procedures and refining our research procedures, it gives us another chance to talk to people who have received the treatment and make some further revisions before we go on to a full trial. We then conduct a larger trial to compare the intervention to the usual care people would normally receive. And then we'll look at the effect on improving health and functioning. Which person gets what treatment will be chosen randomly. We will also check the value for money that this treatment may provide for the NHS. This is workstream 3. Alongside this, we will run workstream 4. In this, we will explore how best to embed the interventions like these into a range of NHS settings. We will use our learning in workstream 4 to develop a range of materials and procedures to help NHS staff use the treatment across a range of healthcare settings such as primary care, psychological therapy services and hospital medical services. So in the end, we'll have a fully tested intervention and a range of methods to help the uptake of these interventions in the NHS. Throughout the MODS programme, we'll work closely with older adults who have experienced low mood and physical health problems in developing the intervention and conducting the research. This group will be at the core of what we do and will contribute in a range of ways to the programme. Some will be on an advisory group that will meet a few times a year. Some will become part of the research team, and some will sit on an oversight group that will make sure that we conduct this research well. We will add more information to this website as we go along. We will also be speaking to health professionals throughout the programme, as we need to make sure the things that we develop in the programme are realistic and have a chance to be used in NHS today. Anyone who would like to get involved, please feel free to drop us a line through the contacts on the website. MODS is a 5-year, 9-month programme of research funded by the National Institute of Health Research. It aims to improve the way that we can help older adults with multiple physical and emotional healthcare needs to improve their day-to-day functioning and how they feel. We will update this website as we go along with further information. Thank you for taking time to watch this video, and please feel free to drop us a line for more information if you so wish.